Welcome back to the Finding Genius video series. I'm here with Andrew Parker. Andrew, thanks a lot for joining me.
Thank you for having me.
Appreciate it. Andrew's the founder of Papa, which is an elderly care platform that connects college students with senior citizens who need assistance with chores, lessons, and enabling the elderly to stay independent. Papa's coming off the Series B with Canaan Partners, Comcast Ventures, Sound Ventures, and Scott Belsky. Andrew, just to kick it off, could you talk a bit more about Papa and where the inspiration for the idea came from? I know you were at MD Live before that.
Yeah, so prior to Papa, I was at MD Live where I ran health system sales and strategy, and it was a really great opportunity for me to learn about healthcare and building a startup from scratch. You know, when I started it, it was like 7 of us in a room, and became one of the largest telehealth companies. And of course, telehealth has become very prevalent in recent history. And so for me, I always wanted to be an entrepreneur. My father was an entrepreneur. My grandfather was an entrepreneur, so kind of in my blood, so to speak. And didn't have a great idea, but I did have a personal need, which was my grandfather, who we called Papa, needed help. He didn't need bathing and toileting and traditional home care services. He needed really a friend, or a pal as we call him now. And so I decided to pair him with a young college student. It was a nursing student. Her name was Andrea, and he absolutely loved her. And I think it was super surprising to me and somewhat of an aha moment. My grandfather, who wasn't really too excited about anything new, was willing to try this new thing to really help him and provide him support and companionship. And so with that, I tested it out with like 10 family friends and neighbors and really anyone who would be willing to try it, and ultimately decided to leave MD Live full-time in 2017, and so launched Papa in January of 2018. And we connect older adults and families to what we call Papa Pals for companionship and assistance.
Interesting. Could you talk about what those first 6 months looked like? I think you started 3 months while you were still at MD Live, or kind of towards the end, and then when you decided to quit to do this full time, and what those challenges looked like early on.
Yeah, I always say there's not like a silver bullet. It wasn't like a sign that went off or some buzzer or alarm. It was obviously a big leap of faith in the idea, and obviously in myself and my co-founder. But early on, it was hustling and very, very, very scrappy. Going door to door, going to senior living communities, going to doctor offices, LinkedIning anyone who would talk to me, and just trying to get that initial traction, trying Google ads and Facebook ads and anything you could think of. And really the goal was just to get one person to sign up, and then 2 people to sign up, and then 3 people, and so on and so forth. And you're learning along the way. How do we hire pals? What does a pal look like? In terms of what are they doing? What's their training? What's their personality? What services are they doing? What services are they not doing? And how do people access this? Are they older people, or is it families? So a lot of experimenting, a lot of iterating in a very short time period. And when I quit, my job, it wasn't like, again, this like silver bullet or, obvious sign, but what was obvious to me was that the 10 members I got to use it were absolutely in love with it. And, I read this thing in Y Combinator a while back, just before I applied, that said, it's more important to have, 10 people that really love your product than 1 million people that download it and don't care. And I'm like, oh my God, we have that. We have that. And we went forward with it.
Nice. And what side of sorry, did you guys go through Y Combinator as well?
We went through Y Combinator in summer of 2018, about 6 months after we launched, which is amazing. I mean, I'm from Miami, which now is the coolest place to be in tech, but at the time it wasn't.
Okay. And so how big was Papa when you went into Y Combinator? Was it with the 10 or so families that you had on it?
No, I think we got it up to about 30 to 40 members at the time, and they were using it like multiple times a week. I think our monthly revenue was getting up to like $7,000 a month, which was pretty exciting for me at the time. I know Y Combinator accepts people with no traction, with just an idea, right. With a lot of traction. It really depends on, I guess, many factors. For us, I think we hit on a big need, and a need that was becoming more prevalent, and likely a need that was impacting people reviewing our application, because you don't really realize the need until your mom needs help, or your grandma needs help.
Right. And what were the biggest areas that Y Combinator sort of helped you build this out at the time?
Well, for us, really got us to understand our customers. It really helped us look at it at a granular level. Our revenue was going up, but we had a big leaky bucket. Understanding cohort analysis and how long people are on the system for and what's getting them to jump off the system, and why are they attracted to the solution, and how much did it cost to acquire them, and to really be thoughtful about unit economics. And just seeing a line go up on the top doesn't really mean necessarily that you have a good business. Of course it could. So that was helpful. And also just honestly, people to bounce your ideas off of, really smart people in Y Combinator. And not every idea is good, but they're data points nonetheless, and help you think through it. And also ensure we're focused. We were very focused on getting to a specific number and growth rate by demo day, which it's good to stage gate goals and create milestones, and create really big goals that are maybe unachievable, but to put your team together to do it. And it helped us think about growing a business that way.
And I guess in those days, or has it changed since then, but were you having a harder time with one side of the market, with the pals or with the papas, of kind of articulating the value proposition to them and keeping them on the platform, or has it been fairly steady on both sides over time?
There's always a push and pull, or a chicken and egg. For us, it was easier in the beginning to get pals and much harder to get seniors. Like, it wasn't even a comparison. I think within like 30 days of starting Papa, we had 200 pals on the platform. Quickly, a lot of them fell off because we had no members to help them. But we're like, oh my God, the pals love it. And then we're like, well, we actually need the other side of the platform for this to work. Otherwise, we just have a network of people that don't have an ability to make money or help anyone. So that was hard at first. And what's interesting is once we started to grow pretty rapidly, and then once we started to work with health plans, all of a sudden we had this kind of unlimited demand. And we were able to meet it, thankfully, because we had a lot of interest on the PAL side. But if I had to choose a side today, fast forward, almost 3 years later, the PAL side is the more challenging side. And by challenging, I don't mean in acquiring PALs or finding the right PALs, but the little intricate pieces of, getting a national network to do what you want when you want them to do, and exactly the way you want them to do it.
Right. Can you talk about what sort of storytelling or tools did you use to get papas to actually trust the pals? Because I know, getting them on board and also on your end vetting the pals too, but how did you build that first layer of trust?
So what's funny is because we brought in a large team now. We have 160 employees, and for me, I'm super nostalgic. And I always go back to like the beginning. Like, how were we thinking in the beginning this would work? And I found our early onboarding manual, and it's roughly the same, frankly, as it is now. Obviously, super automated, and different products leveraged to automate it and make sure that we're choosing the right PAL. So that's a pretty interesting part of it. We take them through a very strict process. Like, becoming a PAL is not easy. You have to have the right personality. You have to have the right training. You have to self-select. You have to want to do this. Not everyone wants to help an older adult. What's interesting to us, and I think what's been really interesting in general, is by removing bathing and toileting, kind of the icky part of senior care, it actually opens it up to people like you and I that frankly wouldn't have done that. And now you're just hanging out and helping out. So we've opened this up to a new category of people. Stay-at-home moms tend to be really great pals. College students, which was our original model, also still tend to be really great pals. But you and I could be great pals too. And it's really anyone who's really fun, youthful, not necessarily young, energetic, but trustworthy, can follow the rules, can be there for someone from an empathetic and a sympathetic perspective, can sympathize with the fact that older adults are lonely and more isolated than ever, and just listen. So we've been good at finding those people, and over time we're trying to algorithmically do it. Before it was more like, hey, can all tell me about you? And now we're doing that in a much more productized way. And then once you're in the home, what do you talk about? Some seniors are mad some days and happy the next day, or want to talk about sports one day and don't even remember that they were talking about that the previous day. So how do you handle that with a national network of pals? And so we're thinking about it on a very granular level to almost scientifically pair people, and obviously from an algorithmic perspective, but okay, if I grew up in South Florida and I have 4 brothers and I am an entrepreneur, maybe pair me with a pal or a member, depending, that has similar traits, and I could be like, oh, I worked at Disney. And the pal would be like, I'm actually interning at Disney also. And you could imagine how much natural magic happens there. Early on, it was very natural. And now because we've scaled, we're doing 50,000 visits a month right now, which is significant. How do we make that magic continue to happen, in the same way it did with my papa and Andrea, 3 years ago, and to do that, thousands of times a day.
Yeah, that's really incredible. I'm sure everybody's thinking about their grandparents right now also. But when you're talking about that growth curve that you had on onboarding more of the papas and that side of it, was it always your intention to work with health plans, or was that something that you stumbled into a bit further to see more people come on the platform?
Yeah, so my whole background is selling into health plans, actually. So I don't think that I would have figured that out, frankly. It's a very odd approach, like from the outside in. In fact, most of the venture community was like, this should be a consumer business. I even remember having a call with Paul Graham at Y Combinator, and he's amazing, one of the smartest people, if you could imagine, and just everything that embodies like what it means to be a Silicon Valley founder, like he has it. Yeah. And he's even like, why are you guys doing Medicare Advantage, or why would you even go after that market if you're having so much success with consumer? And we're like, this is the way to do it. And he didn't see it. And frankly, now, of course, he does. And neither did most, because they were so used to this like consumer Uberized marketplace. And they assumed, and so did our predecessors, to say, oh, you got to get a consumer to do it. Well, if you don't need bathing and toileting, unless you're super wealthy, are you really going to be able to afford someone to just come out, hang out with your parent? It's kind of a nice to have from the consumer's perspective. And then healthcare is realizing, well, 80% of outcomes are social determinants. If you're lonely and isolated and don't have a car and don't have money and don't have a house, you're gonna die. And so by pairing you with a pal that could observe these things and bring you to these places and help you with these items, so powerful. So the healthcare system and health plans in general, Medicare, said, you know what? Social issues are important, and we're doing a good job at the clinical stuff, but that's already, we're already in a bad position. That's sick care versus healthcare. And so CMS, the Medicare, regulatory body, said, okay, we will pay for companionship. And Papa had, this is also another thing that I don't think most would do, or frankly should do. We had all the compliance, we had all the security, we had all the processes, which is not, to be taken lighthearted, really complicated, really costly and time consuming. And we did that. And then, so once they said, we approve companionship, boom, Papa just went at it. And we went from one health plan early on, which was Humana, to today we have over 40 different health plan partners.
Wow. And how much of that was Papa helping to move CMS in that direction of looking at social determinants of health as very important to kind of the holistic care as opposed to just clinical?
I'd like to say that it was us that pushed them to that direction, but really it was a long time coming. And then the pandemic hit, and it was like, okay, thank God we had this in place, because this is so important. And people are more isolated and lonely than ever. I don't think I predicted fully that loneliness would become like the biggest topic in healthcare. And now like it's a full-blown channel. It's a space. There's the loneliness space, and we're leading the helm, and it's exciting. And obviously not exciting that so many people are lonely, but exciting that we can help people. And then now we're like, okay, what else can we do? We're their trusted advisor. We talk to them more than their physician. We talk to them, more than their family most of the time. And so we just recently announced Papa Health, which is our foray into not only companionship but clinical care. So we've effectively built a curated platform for companionship and care, and we brought in a network of primary care physicians to do virtual visits with our members, leveraging the PAL to help facilitate the experience or the care plan. So if your care plan says you need to get your labs done, you need to eat these healthy items, well, how are you going to get to the grocery store if you don't have a car? How are you going to get to the lab test? How are you going to even use your iPhone if you don't even know how to use it or don't have one? And so the PAL helps facilitate that, and the platform captures data all the way throughout the whole thing, and then shares it with the health plan to say, not only is this a nice to have in making your people feel good, which is actually really important to health plans now more than ever because of the way they get paid from the government, but we're actually informing you, this person has mold, this person has COPD, they haven't been able to get in touch with their doctor. So being the boots on the ground in the home, it's an amazing opportunity for us to help people, not only seniors, but really families. We've expanded beyond seniors into family care, into employer benefits to support people. And it's really part of our journey the whole time. Our mission has not changed since day one.
So this delivery model of getting providers into people's homes now is something that I actually didn't know about before this conversation. So is that pretty challenging to execute? Do you see that becoming the bigger part of the business over time, over the PALs, or is it
So PALs are always the core. So it will always be this. The program works. We get a file from the health plans. We reach out and we say, hey, this is Andrew, your Papa Pal. This has been offered by your health plan. Humana is one of our partners, for example. Aetna is one of our partners. Florida Blue is one of our partners. Priority Health is one of our partners, just for example. And their members are getting this benefit through their Medicare Advantage provider. And then now we're going back to them and saying, okay, great, you love your PAL. Let's also connect you with a virtual primary care doctor if you don't have one. If you have one, we're not trying to break a relationship. Or if you don't have one, or if you have one, you haven't talked to them, we'll share the data with them. So continuity is really critical. But now to bring in that doctor virtually. So the PAL's in person with the member, and they're like, oh, do you have an iPhone? Yeah, my grandson got me the iPhone. Okay, great. Would you like to do video? I don't know how to do video. Okay, great. Let me teach you how to do it. It may not happen the first day. It may not happen the second day. It may happen 6 months later. But ultimately, we'll get them into a technology that allows us to support them in more ways. And so now we've built a national network of board-certified physicians. We call them Papa Docs. This isn't your traditional, you go to a visit, 5 minutes, and the doctor gives you a prescription, you leave. These are 45-minute to an hour and 15-minute calls. This is your personal primary care doctor. They're assigned to you, you're scheduled, and then the PAL helps facilitate the care plan that's provided.
Given you led sales at MD Live, and then now you've been pretty successful selling to health plans for Papa. Can you talk about what strategies you've had or what you can share, maybe from your Y Combinator data or just actually doing it, that would be helpful for other healthcare founders selling into health plans?
It is very hard. You have to be sophisticated in something that you probably haven't had much experience in. So learn as much as you can, first and foremost. And little things like how they talk about stuff. Like, a lot of people talk about, this is like a classic statement, like PMPM or PEPM, like per member per month. And people are always like, what's the difference between PEPM and PMPM? And someone who's been in healthcare for like 20 years or me like 12 years, they would say, well, one's belly buttons and one's doorknobs. And like, that sounds like such a colloquial term, but like saying that, like little nuances of how you speak about things, people know like, oh, this person's been in healthcare. They're sophisticated around it. That's obviously a loose example. You have to make sure you're providing reporting. You're thinking about ROI and value. You're getting to the right person, and you're a priority. So you could be the best salesperson in the world with the best product in the world, but if you're not a priority, you're not going to move the needle. It happened with telehealth with me in my career. Obamacare hit, boom, became a priority. That happened in the middle of MD Live. Before that, I don't think it would have worked. Yeah. And then same thing with Papa. Companionship became a thing. It became relevant, and it became something that can improve the health of older adults and families. And then Papa was right there at the right time. I mean, the way I got in touch with Humana originally was I saw an article. This is actually a pretty good hack, I think. I saw an article that said, we're talking about loneliness. We're focused on the Bold Goal Initiative to reduce unhealthy days, 20% by 2020. And we have a loneliness team. And I'm like, oh my God, this is amazing. And I've been trying to get in touch with them. So the person quoted on this press release was the person I LinkedIn messaged, and ultimately got in touch with them and, later became a large partner of ours. But a lot of people don't go that route. They're always looking for like the head of this, head of that, head of this. Right. The people in those press releases don't get a lot of outreach. And so if you're able to outreach them and you have the product that fits within what they're interested in, and they're like, we've been looking for a loneliness solution. And I'm like, perfect. And, and then going through the presentation, knowing what's important to them. How does this help my members? What is the value to the health plan? Is there an ROI? Have you done this before? What are the proof points?
That's really interesting. And so that loneliness solution that you're talking about, a lot of folks might not be familiar with the concept of social determinants of health. Could you talk a bit, just briefly about that? And then also, are you seeing reimbursements towards that space going up over time? Do you think it'll shrink post-COVID? How do you think that will change from CMS or even the private insurers?
Yeah, so social determinants of health is a fancy way of saying like social economic issues affect your health. If you live in an area where there's not access to high-speed internet, you don't have a car, you're food insecure, meaning you can't afford healthy foods, or you're just kind of not able to figure that out. You're lonely, you're isolated. These things affect you, and of course housing is part of that too. And it's a very big piece of this. I mean, if you look at social and economic status and then you look and you align that to health, the data is very obvious. And it's not like this data is new. It's been obvious, and it's kind of very obvious when you just think about it out loud. And so now healthcare is saying, okay, this is important. And because we're Medicare Advantage and because we get paid from the government to support people's health, like value-based care versus just a transaction every time you come to the doctor, it's important for me to think about these factors that have negative impacts on your health. And so social determinants of health, or SDOH, more commonly known, is probably one of the most relevant topics in healthcare today. And then with COVID, it became even more relevant. So the same people that had trouble before, it just became exponential, with the fact that they can't leave their house, and the pandemic is, still in process. Hopefully that ends soon. So these changes in social determinants of health as it relates to healthcare's interest and ability to pay for it did not happen because of COVID. It was a year and a half, 2 years before COVID. It's just timing-wise interesting that when COVID happened, that these rules just were put in place. But I think it's also just where we're at, in human evolution. Like 2021, we're thinking about, people, whole people, not just, oh, you have a cold, let me give you a Z-Pack or whatever, or Tamiflu to be more appropriate. And so social determinants of health are really relevant. They're able to pay for it, and it's just getting bigger and bigger. Actually, CMS every year comes out with like a call letter that effectively says, like, here are the new things we're doing and the changes we're making. And I would say the last like 3 or 4 call letters all have had social services or social determinants of health incorporated into it, because the data shows that 80% of outcomes are driven by these things. It's easy to be healthy if you know how to eat healthy and you go to the gym and you have money to get to the doctor and you're seeing your primary care physician. Outside of a genetic disorder or a family history, it's easier to be healthy. But if you're missing all of those things, it's almost impossible.
And is CMS the one that usually drives this thinking?
CMS makes all the rules for what's paid for by the Medicare Advantage providers.
But then the private insurers would follow that.
No, so Medicare Advantage actually is, the government pays for it, but managed by private insurance. So Humana, Aetna, Anthem, WellCare, like the Blues Cross Blue Shield, they get money from the government. They're Medicare still, but it's called Medicare Advantage. It's privately administered, government sponsored.
Okay.
And Medicare Traditional also is able to pay for that, which is called Z codes. Actually, codes that have been created to bill for social services in 15-minute increments or 1-hour increments. So it's a huge evolution that's been a long time coming. And, I think just Papa was right place, right time with that. And, we saw it. I saw it with my grandpa. I didn't know that this would be that important. And just having someone with him to hang out with him, a lot of this is things that you and I could do. We're not nurses.
I know we're nearing our time, but just can you talk about, as a CEO, and especially as a CEO of a healthcare company, and then the kind of company that you're launching, during COVID, it probably hit you in many different ways because of especially delivering care in home, either from the patient side or the provider side. Can you talk about how you navigated that, the initial impact of the business, and then you also fundraised during that?
It sounds actually way more insane when you're hearing it from you. I'm like, oh yeah, that is pretty cool. So, the way we think about like company ending issues, potential issues, which we don't think about a lot, obviously, is a pandemic hit. It disproportionately affects older people. It's not impacting younger people as much, but they, in the beginning at least, we were told they're spreaders, which I think the debate's still out. So you couldn't have a worse business than pairing older people with younger people than Papa. And my friends calling me like, hey man, I'm here for you. Like they knew I failed in their heads. And I'm like, no, we figured it out immediately. And we didn't think about it like we're going to fail. We really thought about how we can help these members. They're really in the most need, more need than ever before. We thought they were isolated before, and they were, but now they can't leave their house. And the news is telling them the world's ending, and so they're scared. And depending on what they're looking at, and you forget about fake news, they will read all the fake news. They can't tell the difference for the most part. So it's really scary. So what's interesting is, looking back, is we've recently shifted our company into OKRs, so objectives and key results, kind of the Google, measure what matters from Intel. And we did it at the time during COVID, and we didn't realize, where we shifted the entire company to say, okay, we're going virtual. We had to convince the health plans to continue to pay for it and allow us to do it. We had to train the pals in order to do this. We had to update our system to do it. And it's not just setting a phone system. These are older people. How do we get them on the phone? How do we get them in video? How do we get them to kind of move away from in person? How do we reschedule everything? How do we charge for this? How do we track it? How does our call center get trained for it? So the whole company, in like a dime, in 72 hours, went from 100% in person to 100% virtual. In December of this year, we did 40,000 virtual visits.
Wow.
And so it's a big part of our platform now. And frankly, something I always wanted to do. My background is virtual, effectively. I'm a telehealth guy. I mean, that's where I came from. And I always would say, virtual is not going to work because they won't do it. And that was true. And by the way, that was true with telehealth adoption. I'm like, the best way to get everyone to do telehealth is to get everyone sick. It was kind of a joke, but unfortunately became real. And I knew that because it's a behavior change. Like, it's hard to make everyone's mindset change about the doctor, you go in person. Oh, companionship, you do that in person. How are you supposed to help someone virtually? And so the seniors, we don't need technology. But boom, that day happened, and they're all like, you know what? I do have an iPhone, or I do want to use technology. I want to learn how to use it. And now they're raising their hand saying, I'm ready. And that's why we did virtual visits, of course, and we were able to get the adoption because of COVID. And now we're able to say, okay, we got them in the video. We've done a good job at that. We should help them in more ways. Let's bring in a provider. Let's bring in a primary care physician. It's very exciting. It's very exciting. And though a pandemic was what was required to make that happen, I believe that and I think everyone knows that it has sped up digital health by 10 years at least.
And it sounds like your team navigated it really well.
Oh my God. It's a miracle, and it's amazing. And it's really because we're all really aligned on our mission, and we're all very enthusiastic. And I'm always very excited, if you couldn't tell. It's exciting that we're building something that's helping the world. And
thank you so much, Andrew. I really appreciate this. This is very.
Thank you so much. Thanks for having me.